Oh, good afternoon, everyone. One of my first acts as Prime Minister was to call a Royal Commission into the aged care sector and also to look specifically at the issues of young Australians who find themselves in aged care facilities around the country. I said at the time that I believed it would be a very uncomfortable exercise for all Australians as we listened to the stories and were shocked and disturbed at the treatment of our older Australians in their moments of greatest vulnerability. I think there are a few families around the country, my own included, who are not unfamiliar with the difficult decisions that are made about relatives and loved ones who are placed into aged care facilities, whether those are residential facilities or they're accessing in-home care. It's a very sensitive issue and a rightly so for all Australians. And in commissioning the Royal Commission, my intent was to ensure that we could shine quite a bright light, that we could learn deeply from the experiences and the practices that the Royal Commission was able to identify, and to assist us deal with an issue which is not new. The Royal Commission's interim report has talked about settings and processes and issues that are not new, that go back over many administrations over a long period of time. But it falls to our government to be able to address the issues that are being identified out of the Royal Commission. And as we've had the interim response report from the Royal Commission, it is now our task to provide an immediate response to that interim report, as I promised I would do before the end of the year, addressing the specific issues that they highlighted in that interim report. These responses together do go to those matters, but I want to stress again that what we really need to establish above and beyond everything else is a culture of respect for older Australians. That this cultural change that has once again been highlighted, I think, by the interim report of the Royal Commission, that requires a broader response than just from governments. It's something that goes, I think, to each and every Australian home and family around the country. And so we will do our part as part of making that shift in that culture, and also to do the practical things that are necessary now. Of course, there will be further responses that will be made in this area. There'll be further responses in the budget. There will be further responses in respect to the final recommendations of the Royal Commission and or other matters as they arise. Today's announcement is our immediate response to the matters that were highlighted by the interim report of the Royal Commission. So let me run through these. There will be an additional funding package of $537 million provided to the health portfolio. That will address three priority areas. The first is investing just under $500 million for an additional 10,000 home care packages. Secondly, there's just over $25 million to improve medication management programs to reduce the use of medication as a chemical restraint on aged care residents and at home. There will be $10 million for an additional dementia training and support for aged care workers and providers, including to reduce the use of chemical restraint. And there will be additional funds, just under $5 million, to help meet new targets to remove younger people with disabilities from residential aged care. And I stress that funding is in addition to the funding that already exists within the National Disability Insurance Scheme, which I will ask the Minister to speak of directly. Now, this work, in terms of addressing the issues that were highlighted in the interim report of the Royal Commission, reflects work that is already underway and has been for some time now. Already, we have increased the number of in-home care places by 44,000 since the 2018-19 budget alone, at a cost of some $2.7 billion, including today's announcements. Already, we have seen the number of young people in aged care facilities fall from 6,287 to 5,606 on the most recent information, and there is further work to do there, and the Minister will set out the works that we have in train to also address that goal. But before handing over to the Health Minister, I want to assure all Australians that we will deal with these issues as you would if you were standing in my shoes today. I know quite precisely the sorts of things that you are thinking about at the moment when it comes to the treatment of your loved ones in aged care. My family is no different to yours in that respect. And so I have a very deep understanding of the difficult decisions that you're having to make, the conversations you're having to have with the partners, husbands, wives of those loved ones going into care, other siblings. This is hard, and you just want to be assured that they're going to get the care. I want that as much for your family as I want it for mine, and I want the response of our government to have that same level of deep care and responsibility. Greg.
Thanks very much, Prime Minister. Firstly, to acknowledge the work of the Royal Commissioners. They have fearlessly examined the challenges that Australians face in providing for their later years. I acknowledge both Commissioner Briggs and particularly Commissioner Tracy, who passed away. And he worked until his very latest days whilst he was facing a terminal condition, and he was determined to finish this report. And in a way, this interim report is his legacy. So I particularly want to acknowledge and thank them for that, and for the fearless but constructive way in which they've gone about it. The interim report sets out, as the Prime Minister said, 3 initial priorities. They are findings as opposed to recommendations, but we have acted on those priorities and findings. Firstly, in relation to home care, we accept the views of the Royal Commission that there needs to be a fundamental reform to unify the home care and home support programs. That is a long-term reform which will bring about a very significant change. Tailored care for our older Australians, whether it's in-home with lower needs or in-home with higher needs. And we're going through a fundamental change already, but this is an absolutely indispensable step forward to make this home care system something which will address the needs of every senior Australian. Secondly, as part of that, there is the immediate provision of 10,000 places, and those places are about ensuring that there's additional care, and that is tailored to meet the capacity of the workforce to expand. The Commission was very, very clear on this, as was a previous Royal Commission, about the need to expand the workforce in line with the capacity for safety and quality, and that's been a very important part of our deliberations on that front. And then as we do this, we will also have a single assessment process. That then brings me to what we're doing in relation to dementia and medication management. The Commission found that there had been medication management used as a form of chemical restraint in circumstances. We immediately acted on the day of the report to have the safe and quality use of medicines raised through the COAG Health Council to be a national health priority for the first time. Now we are moving, as of the 1st of January, to ensure that the medicine risperidone is only available for a 12-week period without a subsequent approval. This is a very, very important step forward. Risperidone has been identified as an antipsychotic which has been the subject of overuse and overprescription for chemical restraint purposes. We have worked with the PBAC, with the AMA, the College of GPs, and with other parts of the medical and health profession. This will provide a break, a restraint and an oversight on the use of antipsychotics in our aged care homes to protect our residents. As well as that, as the Prime Minister mentioned, there will be $25 million for medication management to ensure more frequent medication management, and $10 million to support the training of dementia workers in terms of aged care. So it will support them be able to better provide for, better care for and better take care of our senior Australians with dementia. Minister Robert will address in more detail what we're doing with younger Australians in aged care, but the bottom line is that we are accepting the 3 goals which the Royal Commissioners have set out as being the new targets which Australia should embrace.
Thank you. Richard. Thank you.
Thanks, PM. Just in respect of the new home care packages, as the Prime Minister and Minister Hunt has indicated there's an additional 10,000 packages that will become available commencing from the 1st of December this year. 5,500 packages in the first year, and that's at a cost of just under $500 million, so a significant investment. And the additional work that we're doing with respect to training staff in the and providing assistance for people in crisis with dementia care is also going to be extremely important. That's $10 million going to some existing programs that are currently receiving about $37 million a year. So that'll bolster that work, which builds on the work that we're already doing. And it's important to note, as the Prime Minister has, that we've put an additional 44,000 home care packages into the system since last year's budget at a cost of $2.7 billion. So not only do we recognise the need to act off the back of the Royal Commission's interim report, we have recognised that for a period of time. When we came to government, there were about 60,000 home care packages in the system. This additional investment will bring the figures for this year to 150,000. That is a significant increase in the capacity of the home care sector, and the Royal Commission did note that the demand for home care packages has increased significantly as we've put additional capacity into the market. So just flooding the market with additional packages is not something that they recommended we do, but they said we wanted additional capacity, and they did point to the need to do a couple of things. One is reform the way, change the way the home care was delivered, but also to bring into place the single assessment process, which prevents people cycling through a number of assessments as they require delivery of their home care packages.
Thank you, Richard. Stuart.
Thanks, PM. As the Prime Minister says, the government has fully embraced the interim recommendations of the Royal Commission in terms of meeting the younger persons in residential aged care targets of by 2022 no younger person under the age of 45 and no new younger people entering aged care, and everyone out of aged care under the age of 65 by 2025 if that is their choice. The vast bulk of younger people in residential aged care are NDIS participants. As of the 30th of June, 3,788 of them. They all have individual plans. A task force, a joint agency task force, has been set up between Department of Social Services, the NDIA and Health to action these strong commitments and goals of removing younger people out of residential aged care. There are 40 staff already in there, growing in the coming months to 80. We'll be working with all sectors of the economy, including service or specialist disability accommodation providers and providers of supported independent living to ensure these targets are met. Pleasingly, the last 2 years we've seen 11% reduction of Australians or younger Australians in residential aged care. In the last 2 years we've seen a 22% reduction in the quarter-by-quarter number of new people entering. So the work the government's doing, and especially the NDIA, is starting to work. I'm looking forward now to finalising in line with the Royal Commission recommendations.
Thank you.
Now, happy to take questions. Obviously, this is an initial response. There is more to be done and more will be done.